Is it not written, 'My house shall be called a house of prayer for all the nations'? But you have made it a den of robbers." These words, echoing the words of the prophets Isaiah and Jeremiah, reveal that Jesus was angry because universal access to the temple had been diminished. All nations were not allowed into the temple. All peoples were not equally welcomed. The hierarchy of the courts established that. This would upset Jesus, a man who so regularly sought out the marginalized, dined with sinners and women, and blessed the poor and the meek. And not only was access restricted based on nationality and gender, but access had become a profit-making venture. The house of prayer had become, in large part, a place of commerce. Jesus created a disturbance and a ruckus, and it was noticed. The people were spellbound at his teaching, and the authorities, because large numbers of people were spellbound, were afraid. They knew that the unstoppable power of a people set in motion, and Jesus was getting pretty close to setting in motion an unstoppable force that would topple the temple. So they looked for a way to kill him. Now, is there anything in this story that touches you, that inspires, saddens, gladdens, frightens, or challenges you? As you know from the title of this sermon, a deep-seated passion of mine is healthcare reform. As such, this story speaks to me in an uncannily specific way. The same things that made Jesus angry in the temple make me angry when it comes to health care. Lack of universality, profit-making, institutionalization of hierarchical differences in the treatment of people. I will briefly address each of these. Lack of universality. It is no secret that 47 million Americans, including 450,000 Minnesotans, have no health insurance and therefore face insurmountable barriers to accessing health care. My mother-in-law was recently hospitalized for 3 days and her bill was $22,000. Bills of this magnitude drive families into bankruptcy and force people to self-ration their care, to not seek it. Which means that each year 45,000 people die preventable deaths, deaths that wouldn't have happened if they had health insurance. We are not a country nor a state that provides health care for all its people universally and equally. Profit-making. It is no secret that the administrators of health care make billions and billions of dollars while millions and millions of people remain uninsured. The bill that is likely to pass out of Congress will funnel $475 billion to the insurance industry, but will still leave 23 million people uninsured. This pleases Wall Street, where the value of healthcare stocks has soared 30% over the past weeks. But it doesn't do much for those who will continue to remain uninsured, or those who have insurance but won't seek care because they can't afford the deductibles. Institutionalization of hierarchical differences. This one disturbs me most of all. As a physician, I was trained to treat diseases. I didn't learn how to treat a disease based on how much treatment the patient could afford. A poor, uninsured child with diabetes needs insulin and blood glucose strips just as much as a wealthy, well-insured patient. To have to treat them differently based on their economic circumstances is demoralizing and certainly wants to make me overturn the tables. The bill likely to emerge from Congress further institutionalizes this inequity. The starting point for entry into the system to the level of care one can get is based on one's income. Some people will be eligible for subsidies to buy private insurance, and then they have to face a choice. Do they want to buy the basic plan, the enhanced plan, the premium plan, or the premium plus plan? The Senate bill states these as the bronze plan, the silver plan, the gold plan, and the platinum plan. Our reform has done very little to equalize access to health care. For these reasons, I work for a single-payer system of health care, for it is the only reform that passes the muster of what I now call the Temple test. It is universal, money goes to health care, not profit, and all people are treated equally, guaranteed the medical care they need. It is not perfect, nothing is. But when implemented, it will become as beloved as Medicare, and we will say, what took us so long? I am not alone in my support for single-payer health care. It is the choice of most Americans, and it is supported by many communities of faith. It is the reform of choice of the United Church of Christ and the Presbyterian Church. I read the following from the UCC pastoral letter in July of 2009. Health care is not only a basic human right, but a human need. As people of faith, we believe that it is a moral imperative to transform health care so that it is inclusive, accessible, affordable, and accountable. We call on our churches to actively work towards the creation of a national healthcare system and to affirm the moral and justice imperatives of equal access for all people. We, as a denomination, believe that a single-payer plan is what is needed to truly have universal coverage, which is our moral and justice imperative. And from the Presbyterian USA Church document, for over 60 years, Presbyterian Church USA General Assemblies have been calling for reform of the U.S. healthcare system, urging the establishment of a national medical plan that will ensure health coverage for all persons residing in the United States. The most recent General Assembly of 2008 endorsed in principle the provision of single-payer universal health care reform, in which health care services are privately provided and publicly financed, as the program that best responds to the moral imperative of the gospel. Now, as you may know, single-payer reform was not even considered in this most recent national debate. Single-payer advocates, physicians, and legislators were not invited to the table or to the meetings. From the beginning, we were not considered stakeholders in this debate. Despite the fact that single-payer health care reform emerged from town meetings and town hall forums as the reform option with the greatest public support, it was not included in the debate. So now we turn to the state level as the place to make things happen. We have to overturn tables, create a disturbance, challenge the status quo. We must involve people. Enough people to fill the courtyards, the church halls, and the Capitol galleries. People inspired by anger at an unjust system. People inspired to work to make it better. The authorities will ultimately listen to the people. For they were afraid of him because the whole crowd was spellbound by his teaching. We must do this. We must do this so that someday the fact that our brothers and sisters are dying because they do not have access to health care is only a story of the past. It cannot be fact any longer. I invite you to join the single-payer movement in Minnesota. Put the words of your church into action. Now is the time. Thank you and amen.